Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about the importance of having a flare-up plan. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So, the flare-up plan, the way I like to think of a flare-up plan, and this works particularly with certain population groups. So, for example, patients that may be dealing with some persistent pain where perhaps they've had an injury which hasn't necessarily gone through sort of your natural healing process, and it's become more of a persistent pain experience for the patient. And with a lot of these types of patients, a lot of the focus will be on functional strength, right? So identifying different potential imbalances that have occurred as a result of this pain, and then trying to really build up functional strength. So with this population, or again, other conditions, perhaps somebody coming out of surgery, like a total hip or a total knee, where it might be still fairly fresh, there can be fluctuations, or a condition like arthritis, for example, there can be fluctuations in terms of their rehab process, right? So essentially patients might go through a period of time where, hey, they're making nice gains and they're able to perhaps do different activities that they were struggling with before, and then for whatever reason, right, they might have a day where, hey, I'm sore this day. Maybe that week they did an activity that was just a bit too much. Maybe there's a little bit of swelling, irritation. Sometimes things like weather changes might impact how somebody's healing. So there's a quote-unquote flare-up. And I found with certain patients, right, they can become somewhat discouraged, right, during these flare-up times. And so what I really try to encourage patients to look at is, hey, I'm going to have a flare-up plan, right? So it's almost like being proactive with regards to if there are certain days where I'm a little bit sore, having a flare-up plan for those particular days, just so that the patient can continue to feel motivated and sort of in control, right, of their health and of their healing. And so I really like this concept of a flare-up day. And in a lot of cases, certain themes I'll have, right, with these flare-up days. So for example, hey, maybe we're focusing more so on non-weight-bearing exercises that particular day. Maybe it's a matter of basically movement, non-impact movement, in order to flush out some swelling perhaps, or to lubricate the joint. So if we're dealing with, let's say, a knee issue, and perhaps we've really been focusing and working towards more weight-bearing, more functional exercises, more exercises where perhaps there might be a bit of an impact component to it, and there's a flare-up, well, perhaps that day, maybe we hop on the bike with no resistance, right? Maybe we're doing some more of the table bed type exercises. Maybe we're just doing some isometrics that day. So it's really about, coming up with a specific plan for those days in order to, again, I think for the patient, just keeping the patient motivated and sort of in control of the process. And then ideally, hey, after this flare-up has occurred and maybe things have settled, and again, ideally on a flare-up day, these are proactive things to kind of settle the condition, then we can get back to the weight-bearing exercises or the more functional exercises. So again, I just wanted to point out, really, like for me in my practice, just what I found really important for certain patients and conditions is this concept of the flare-up plan, the flare-up day, and I've really found it beneficial right during the rehab process to chat about that and to have that type of plan in place. If you have any specific questions or concerns, feel free to leave a comment below. And please check with a physiotherapist or doctor to make sure that anything that's suggested in these videos is appropriate for you. And thanks again for watching. Have a great day. Take care.